It was a Sunday afternoon, and Helen seemed a little off. Her daughter noticed it over lunch. Her mother's smile looked slightly uneven, like one side of her face wasn't quite keeping up. When Helen reached for her water glass, her hand fumbled it. She caught it, laughed it off, blamed her arthritis. And once or twice, mid-sentence, she reached for a word that wouldn't come, then waved it away. "I'm just tired," she said. "I didn't sleep well." Her daughter almost let it go. It was subtle. Her mother seemed fine otherwise, talking, walking, laughing. There was no dramatic collapse, no clutching of the chest, no falling to the floor. Nothing that looked like the strokes she'd seen in movies. So she told herself it was probably nothing. Maybe they'd mention it to the doctor that week. They didn't get the chance. That evening, Helen had a massive stroke, and in the emergency room, her daughter learned the fact that would haunt her. The subtle signs at lunch had been a warning stroke, a smaller event, hours before the big one. And if they had gone to the hospital when she first noticed the uneven smile, there was a treatment window that could have changed everything. That window had closed while they waited. I'm telling you Helen's story today because stroke is one of the leading causes of death and the leading cause of long-term disability in older adults. And it is one of the most time-sensitive medical emergencies that exists. With stroke, there is a saying in medicine, time is brain. Every minute that passes during a stroke, millions of brain cells die. And the tragedy that families face over and over is that the early signs are often missed, dismissed, or misread as something harmless, exactly as Helen's family did, costing the precious time that determines whether someone recovers fully or is permanently disabled. Today, I'm going to show you exactly what a stroke looks like, including the subtle signs families miss, why every single minute matters, what to do the instant you suspect one, and how to recognize the warning strokes that often come before the big one. Because here is the truth at the center of this video. Recognizing a stroke fast and acting fast is one of the most powerful things a family member can ever do. It can be the difference between full recovery and lifelong disability. It can be the difference between life and death. Before we go further, this is information every family with an aging parent needs to have already, because in a stroke there is no time to look things up. Share this video with the family members who spend time with your parent. And if you haven't subscribed to this channel yet, do it now. Every week one publish content exactly like this, clinical, honest, and built for families navigating the care of an aging parent. Subscribe so you don't miss what's coming. Let me start with what a stroke actually is, because understanding it explains why speed matters so absolutely. A stroke is a brain attack. It happens when blood flow to part of the brain is suddenly cut off, most commonly by a clot blocking an artery, and less commonly by a blood vessel bursting and bleeding into the brain. Either way, the affected part of the brain is starved of the oxygen it needs, and brain cells begin to die within minutes. Whatever that part of the brain controlled, movement, speech, vision, balance, memory, begins to fail. This is why time is everything. For the most common type of stroke, the one caused by a clot, there are treatments that can dissolve or remove the clot and restore blood flow, but they only work within a limited window of a few hours from when symptoms begin. Inside that window, the damage may be reversible or greatly reduced. Outside it, the brain cells are simply gone, and the disability becomes permanent. This is the entire reason that recognizing a stroke and getting to the hospital immediately is so decisive. It is not an exaggeration to say that the minutes your family saves can determine whether your parent walks, speaks, and lives independently again. And here's what makes stroke so dangerous in older adults specifically. The signs can be subtle. They can come without any pain at all, and they're easily confused with other things. Tiredness, a pinched nerve, arthritis, just a bad day, or the general changes families wrongly write off as normal aging. Helen's uneven smile, fumbled glass, and missing words were textbook stroke signs. They just didn't look dramatic enough to alarm anyone. So, let me give you the single most important tool in this entire video, the one I want every family member to memorize. It's an acronym designed to catch a stroke fast. FAST. Arms, speech, time. F is for face. Ask the person to smile. Does one side of the face droop? Is the smile uneven or lopsided? Facial drooping on one side is one of the most classic and recognizable signs of a stroke. This was Helen's uneven smile at lunch. A is for arms. Ask the person to raise both arms above their head. Does one arm drift downward? Is one side weak or numb, unable to stay up? Sudden weakness or numbness on one side of the body, one arm, one leg, one side of the face, is a hallmark of stroke. S is for speech. Ask the person to repeat a simple sentence. Is their speech slurred? Are they struggling to get words out, or using the wrong words, or unable to understand you? Sudden trouble speaking or understanding speech, like Helen reaching for words that wouldn't come, is a critical warning sign. T is for time. If you see any of these signs, any single one of them, it is time to call emergency services immediately. Not wait, not see if it passes, not call the doctor's office tomorrow. Call for an ambulance right now, and note the time the symptoms started, because that time is critical information for the treatment team. FAST is the framework that saves lives. But I want to go beyond it, because there are other stroke signs that fall outside those 4 letters, and families need to know them too. Watch for sudden numbness or weakness anywhere, especially on one side. Sudden confusion or trouble understanding what's happening. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, or loss of balance and coordination, and a sudden severe headache with no known cause, sometimes described as the worst headache of one's life, which can signal the bleeding type of stroke. The common thread in all of these is the word sudden. Stroke symptoms come on abruptly. That suddenness is your signal. If you're finding this valuable, and I hope you are, take 1 second right now and hit the like button. It genuinely helps this content reach other families who need to recognize these signs before they're facing them in real time. Like and keep watching. Now I want to talk about the warning that Helen's family missed, because it may be the most important part of this video. Sometimes before a major stroke, a person experiences what's called a transient ischemic attack, or TIA, often called a mini-stroke or warning stroke. It has all the signs of a stroke, but the symptoms resolve on their own, usually within minutes to an hour, as blood flow is temporarily restored. The face straightens out. The strength returns. The words come back. And because it passes, families do exactly what Helen's family did. They feel relieved, decide it was nothing, and move on. This is a catastrophic mistake. A TIA is not a false alarm. It is one of the most urgent warning signs in all of medicine. It means a stroke was narrowly avoided, and it signals a very high risk of a major permanent stroke in the hours, days, and weeks that follow. A significant number of people who have a TIA go on to have a full stroke soon after, and many of those happen within the first 2 days. So let me say this as clearly as I possibly can. If your parent has stroke symptoms that come and then go away, that is not a reason to relax. It is a medical emergency that requires immediate evaluation. Those temporary symptoms are a warning shot, a chance to intervene, to identify the cause, and to prevent the devastating stroke that may be coming. That chance is precious, and it is easy to waste. Do not wait for symptoms to come back. Act on the warning. Now, let me tell you exactly what to do the moment you suspect a stroke, because knowing the signs is only half of it. The response matters just as much. Call emergency services immediately. Do not drive your parent to the hospital yourself unless you have absolutely no other option. An ambulance begins treatment on the way and gets your parent to the right care faster and into the system ahead of arrival. Do not wait to see if the symptoms improve. Do not give them food, drink, or medication, including aspirin, because if it's the bleeding type of stroke, aspirin can make it worse, and that decision belongs to the medical team. Note the exact time the symptoms started or the last time your parent was seen normal, because this single piece of information shapes which treatments are possible. And stay calm and reassuring with your parent, keeping them safe and comfortable while help is on the way. The instinct many families have to wait, to watch, to avoid overreacting, to not want to cause a fuss over what might be nothing, is the instinct that costs lives and function in stroke. I want to give you permission right now to overreact. If you suspect a stroke, calling for help and being wrong is a wonderful outcome. Waiting and being right is a tragedy. Always err on the side of acting immediately. This is the moment where I want to ask you something directly. If this video has taught you something you didn't know, the fast signs, the danger of a warning stroke, the absolute urgency of time, share it with the family members who spend time with your parent, because any one of them might be the person in the room when it happens. The more people who know fast, the more likely someone acts in time. Share it. Leave a comment below, especially if your family has experienced a stroke and learned something worth passing on. And subscribe if you haven't yet. Let me also speak briefly to prevention, because the best stroke is the one that never happens. Many strokes are preventable, and the risk factors are largely the same ones we talk about throughout this channel. High blood pressure is the single biggest risk factor for stroke, and it's often silent, which is why regular monitoring and control matter so much. An irregular heart rhythm called atrial fibrillation dramatically raises stroke risk and is frequently undiagnosed. So it's worth asking the doctor about. Diabetes, high cholesterol, smoking, and physical inactivity all contribute. So the ongoing work of helping your parent manage blood pressure, stay active, take medications as prescribed, and attend regular checkups is not separate from stroke prevention. It is stroke prevention. Every one of those habits lowers the odds that your family ever has to use the FAST test in an emergency. Here's what your family can do today. Memorize FAST, face, arms, speech, time. Teach it to everyone who spends time with your parent. This is knowledge that has to already be in your head before the moment arrives, because in a stroke there is no time to search for it. This week, talk with your family about what to do if a stroke is suspected. Call emergency services immediately. Note the time symptoms started. Don't wait. Don't drive if an ambulance is available. Don't give food or medication. Make the plan now so no one hesitates later. This month, address prevention. Make sure your parent's blood pressure is being monitored and controlled. Ask the doctor about atrial fibrillation and other risk factors, and support the daily habits that lower stroke risk. Ongoing, stay alert to sudden changes. Take any temporary stroke-like symptoms as the emergency they are, and never talk yourself out of acting because the signs seem subtle or you don't want to overreact. In stroke, acting fast is everything. Here's what I want you to carry with you from today. Helen's daughter did nothing wrong out of carelessness. She did what most loving, reasonable people do. She saw something subtle. She didn't want to overreact, and she told herself it was probably nothing. The heartbreak of her story is that the information that could have changed everything is information she simply didn't have. She didn't know that an uneven smile and a fumbled glass and a missing word together were a brain in trouble. She didn't know that symptoms which pass are a warning, not an all clear. She didn't know that a few hours could decide the rest of her mother's life. Now you know all of it, and that knowledge, sitting ready in your mind, may one day be the most important thing you ever carried on an ordinary Sunday afternoon. If you ever notice that uneven smile, you will not wait. You will not wonder. You will act. And that action could give your parent back their life. Learn fast. Teach it to your family. And promise yourself that if the moment ever comes, you will treat every minute like the brain it's saving. If this video gave you something real, something you're going to remember, or teach your family or act on one day, please take a moment to like it. Share it with the people who spend time with your parent, because any one of them could be the one who recognizes the signs in time. And leave a comment below telling me about your own experience, what helped or what you wish you'd known sooner. I read every single one. And if you haven't subscribed to this channel yet, please subscribe. This is where I publish honest, clinical, practical guidance for families trying to do right by the people they love every single week. Thank you for being here and for caring enough to watch all the way to the end. That attention is exactly what makes the difference. I'll see you soon.